Many of the mycotoxins are genotoxic, meaning they change the genes and rewire you to be immune depleted. Why would it do that? Because it wants to move in. It's going to impact all of the things that you would need to detoxify. It's going to mess up your detoxification pathways through your kidneys, through your liver. It's going to change your gut microbiome and gut wall, which is where our immune system is. And then just in case that wasn't harmful enough, it's going to rewire your genes to make your immune system not function.
This is Doctor Talks. Welcome to Mold, Mycotoxin, and Chronic Illness Summit. I'm your host, Dr. Ann Shippey, and today we get to talk mycotoxins with Dr. Jill Crista. She's a naturopathic doctor, best-selling author, educator, and she is on a mission to help practitioners and patients heal from very complex illnesses. Thank you so much for joining us.
Thank you for having me. This is such a treat to get to chat with you.
Yeah, we're showing up on a Saturday.
Yeah, I loved how you said, let's talk about our favorite topic.
Well, it really is such an important piece to getting patients well. And I know you're so like-minded and you like the data, you like digging into the science and then coming up with solutions.
Yeah. Actual practical solutions. Imagine that.
Yeah. So this is perfect because I'd love you to describe what mycotoxins are. And then we'll start talking about why we need to worry about not just grouping them into one category.
Yes. So mycotoxins are, mold can make us sick with spores, spore fragments, chemicals. So the off-gassed chemicals of happily living metabolizing mold. So we can test for one of those called MPA or mycophenolic acid. And that's just, I kind of joke, I call them mold farts because they're just like off-gassing, just like
Yeah. And you may or may not smell them.
Yeah, right. So they're just part of the living metabolizing, oops, my bad kind of thing if it if it off-gassed. But mycotoxins are so unique. They're made intentionally by the mold to compete out other species. So other types of mold, other bacteria, even some other like in-between bacteria and parasites that like to live in water damaged buildings. And they're made intentionally to harm those other things, to kill their cells.
It's like biological warfare between the organisms.
Yes. And our military's picked up on that. And there are militaries around the world using these mycotoxins as biowarfare.
Yes.
So are they dangerous? Yes. Is everyone affected by them? Yes. Is everyone affected the same? No way. So, and you see this.
Well, and I really love that you said everyone is affected by them because I believe that too. I think, it's just like it's like air pollution or any other type of environmental toxin. There's a spectrum of how we respond, but it's not good for anybody.
Right. And that's the people that say, well, I'm not affected by them. I'm like, yet. Until you have the car accident, until you have the stressful thing happen at work, until you have the food poisoning that throws off your immune system, there's something that is you're building your cup and that's just leaving you more susceptible. So everyone is affected, but everyone has very different susceptibility to it. So it's like dose, duration, previous exposures, nutritional status. Are you a good detoxer or a bad detoxer? Are you constipated? Are you not? Are you a kid? So kids are much more susceptible than adults. So there's lots of different factors that make that susceptibility.
And I'm glad you brought that up because that's an important theme in this series is looking at how the mycotoxins affect children differently and more profoundly. And so as a parent, like we have to be looking at this to keep our children safe. It's as important as, having a roof over their head and having locks on the doors and getting them to school. Providing a safe environment is so important.
So important. I mean, it's right up there with lead. We wouldn't have our kids drinking water out of lead pipes. You wouldn't have them breathing air from a moldy building. It's the same risk factors. So mycotoxins for me, they get a lot of attention because of their intention is to harm something. And they're very expensive for mold to make. That's very hard for mold to make these. It costs them a lot of energy. So they only make them when they're in a competitive environment. So when someone says, it's okay, I only had one mycotoxin come up on my test. I'm like, if you had that mycotoxin, you likely have a layer of others underneath that, because these aren't made in a vacuum. These are made because there's other species around and it's trying to gas bomb the other species. So we will find more mycotoxins as we detox somebody. That's normal. That means we're
Absolutely.
doing a good job. But so that idea of like, it's okay, it was only aspergillus and penicillium that they found. I'm like, that creates quite a dangerous mycotoxin setup, because aspergillus and penicillium are in competition and they will make mycotoxins. And those mycotoxins are carcinogenic. They cause birth defects. They're linked to all kinds of problems. They are toxic to genes, to cells, because again, they're intentionally made to harm another living thing competitively. So we get, I don't know if you're hearing a lot from patients, some people saying, well, I heard that mycotoxins aren't that big a deal now. Actinomycetes are the thing we have to worry about. Have you
I
heard
think
this?
that's misinformation or malinformation.
Agree.
If
I
there's
agree.
actinomyces there, there's mycotoxins there. They're
You
just
got it.
missing them.
Yeah. And so you're going to see more endotoxin and actinomycetes in a gray water spill. So like a sump pump that went bad or something like that, where there's bacteria in the water already, but you're not necessarily not going to see mold
Right.
because it's the same growing conditions. So for me, actinomycetes are important to paying attention to. Same with endotoxin. They're different. Endotoxins are just the cell wall of the bacteria in that area. And actinomycetes, they emit like an antibiotic. So you could be breathing this water damage building air and be kind of like getting the same symptoms as if you were taking an antibiotic. So that's where we get yeast overgrowth. That's where we get some of the gut disruption. So they still, though, are not doing it on purpose. Mycotoxins are made on purpose, energetically expensive, made to harm something. So like you had said in the beginning, now that we've scared everybody, this is very treatable.
Yeah, thank you for that. That's why we're here, to
That's why
provide solutions and understanding.
exactly. And you had asked, what about why should we not see them all the same? There are things that are the same in all of them. They all deplete mitochondria function. They all deplete glutathione in the cells. So when people say, oh, well, that mycotoxin doesn't detox through the glutathione pathway, that's fine. And it is depleting glutathione in the tissues, which is making mitochondria go, and then you feel like you are constantly walking up an escalator going down while the rest of the world is like riding the escalator going up. It's just like mitochondria dysfunction and depletion is so fatiguing. And that's not just muscle. That's how does our brain work? How are our metabolic functions working? Our digestive juices are all of the things, making hormones, all the things that
And
our
doing
system
repair,
needs.
it's part of what we need to be able to have the body replete itself.
Yeah. Yep. So all of them do that. All of them are neurotoxic, which means toxic to the nervous system. This can affect the gut. And even if you're not eating them, that's the distraction by insurance companies is, oh, if you just stop eating mycotoxin food, this isn't from the environment at all. This has nothing to do with your health issues. Total distraction, total lie. Your environment matters. And even if you're inhaling them in animal studies, we see that it affects the gut wall. So you don't have to be eating them to have gut wall effects. And if they're neurotoxic, that gut wall runs off neural programming. So there's reflexes and all of this neurological communication that's happening. And then communication from our vagus nerve up to our brain that says, we just ate protein, we just ate fat, send those juices down so we can digest. Mold gets in the way of all that communication. So then it creates this whole malabsorption problem. And that's a big problem because then you get more nutritional depletion if you can't, you could be eating your food, but you may not be taking it in.
Looking at very well. Yeah, it gets to be such a vicious cycle.
Totally. Yeah. And many of the mycotoxins are genotoxic, meaning they change the genes and rewire you to be immune depleted. Why would it do that? Because it wants to move in. It's going to impact all of the things that you would need to detoxify it. It's going to mess up your detoxification pathways through your kidneys, through your liver. It's going to change your gut microbiome and gut wall, which is where our immune system is. And then just in case that wasn't harmful enough, it's going to rewire your genes to make your immune system not function. You
It
know, I
really
mean, it's
is
just
so profound how many different mechanisms that mycotoxins affect in the body. It's actually kind of amazing that we can even survive with them because it affects so many different aspects.
totally, yeah. And that makes it really hard to recognize. So that's how it's getting missed all over the place. Because depending on the mycotoxin that you're exposed to, or the mycotoxin soup, and depending on your own susceptibility, and I'm not shoemaker trained, but I've heard him say this is a multi-system, multi-symptom illness, and that makes it really hard to pick up. And that's when I developed my questionnaire, because I was in practice working with Lyme patients. And I'm like, how can I get, I found out a lot of my chronic Lyme patients had mold. And that was the reason they had chronic Lyme, and they weren't responding to the Lyme treatment. I thought, how can I get to the mold answer faster? And so that's when I created the questionnaire that I have in my book. It's just like, I was trying to find a way to quantify, how do I figure out if it's Lyme or mold or both? And how do we get to the mold thing faster? Because if we're not addressing the mold, we're never going to make progress on the chronic Lyme.
Yeah.
So the symptoms are completely variant.
Yeah. And they overlap in such a complicated fashion. And do you find a lot of times that the Lyme goes into remission once the mold is dealt with? Yeah,
I
me
certainly
too.
do. Yeah, do you? Yeah. Yeah.
Yeah.
It's so,
When the body's not being immunocompromised, it's like, oh, what is that? Let's get rid of it.
yeah, right. It can recognize it. It can pull it out of hiding. It can do all the things it needs to do to get rid of it. Yeah.
Yeah.
So then some mycotoxins, though, each one kind of has its special sauce, its special thing that it does. And Dr. Neil Nathan and
It's
I are
signature
working.
feature.
Yeah, there you go. Signature feature.
Yeah.
Special sauces. That sounds tasty. We don't want to be
Yeah. It's a restaurant for them.
right for them. We are. Yeah. Yeah. So Dr. Neil Nathan and I are working on a questionnaire project right now he's helped me refine my questionnaire. And we're going to be doing a study that takes a look at the questionnaire. And hopefully from that, what we can determine is, first of all, is the questionnaire valid, but also, are there signature symptom patterns that we see with certain mycotoxins being quite high at that time you're detoxifying it, that time you are loaded with it. And that'll be interesting to see, because I have some fact sheets where I've kind of taken that from my practice, and I've listed the symptoms that I most commonly see with that type of mycotoxin. And in deep diving into that, I learned that, certain mycotoxins that we see a lot, I kind of have like little nicknames for them, because they all kind of do something a little bit different on top of the stuff we talked about, how they're common. So like ochratoxin is a persister mycotoxin. That's what I'm calling it. It's the persister. Zearalenone is an endocrine disruptor, but it's so much more than that. And gliotoxin, one of my jokes is that it lays the red carpet for fungus to come and take over. It just opens the doorway to fungal infection. And so we can talk about each one of those. I mean, I think it's just really good for people to realize that each of these are a little different, not only in the symptoms they're causing, but then what we do to get that healed from the body.
Plan. Yeah. So let's dive in. Shall we start with ochratoxin?
Sure. So ochratoxin being a persister, what that means is it has really high affinity binding to albumin, which is a protein in the blood. And I'm explaining this for your listeners. I know you know this stuff.
Yeah, no, it's perfect. You're doing great.
So this protein in the blood, we have to have a certain amount of it to maintain our blood pressure. It also carries around things like calcium. And so it's a delivery system. Unfortunately, it delivers ochratoxin because it has such a high affinity. It's like a magnet, like a super magnet to that blood protein. And such a super magnet, it'll actually bump off things that albumin should be carrying around in the blood. So that's where we get into the POTS picture, because the calcium and magnesium can't get delivered to tissue. So the whole goal is to try to get that out of our body. And the mycotoxins have a couple of pathways to get out of our body. When we breathe them in, they go into our bloodstream immediately, and they can get carried anywhere in the body. That's why we can see symptoms anywhere. The way that we get it out is we can pee it out, which is why we can test urine mycotoxins. So the kidneys are the job there. We can package them in bile in the liver, and that is carried to the colon, where we're supposed to poop them out. Unfortunately, we recycle a lot of that bile. So we have to interrupt that with binders or things that block the reabsorption, like taurine. It's a beautiful amino acid we can use for that purpose. Or we can do some detoxification with our gut microbiome. So ochratoxin preferentially uses the kidney pathway and then the gut pathway. And then third is the liver. So focusing on liver detoxification with ochratoxin is sort of like, not paying attention to the primary pathway. Primary pathway is kidney, and it will, if it can't bump it off in the kidney, because we have to have some amount of this albumin in our system, the kidneys will take the damage. So they'll take it into the kidney tissue so that it can contribute some bioflavonoids to denature it, bump it off the albumin, put that albumin back into circulation. But unfortunately, that mycotoxin is hanging out now in the interstitial tissue of the kidney, which means the kidney, the stuff of the kidney. So that's how we get kidney cancer. That's how we get nephrotic syndrome. That's how we get IgA nephropathy from ochratoxin. That's how we get ADH resistance, meaning the kidneys stop listening to a hormone that says, hold on to water. Because it says, no, I'm not going to hold on to this. This is a problem. We got to get rid of this. There's a toxin here. So bioflavonoids are the superpower for ochratoxin.
Do you have your favorite ones?
Yeah. So the research shows zeaxanthin and astaxanthin. So I figure, because there's not a whole lot of research on these mycotoxins, like there's no human research because we can't purposefully poison someone to figure out what to do to get you better. Because if it's a poison, just don't expose the poison, right? So we have to take animal research and translate that into humans or molecular. But when I saw the two were zeaxanthin and astaxanthin, if you have a patient who is, or if anyone listening is allergic to fish, that may not be a source that you can tolerate, because a lot of that comes from fish sources. There are plant sources, but I'm like, those are common because they're both orange. They're both the color orange. So I'll bet beta carotene would work. I'll bet vitamin A would work. I'll bet quercetin probably a little bit because it's close to that. Probably a little bit of lycopene would work. So that's what I will do for my patients who can't tolerate anything in the zeaxanthin, astaxanthin. We just go for beta carotene. And it is amazing to see that ochratoxin level just drop, because we're now supporting the primary way that the body wants to get rid of it.
Beautiful.
Yeah.
So
that's my big tip for ochratoxin.
That's a great
bioflavonoids,
which are good to be taking anyway. They're helpful for so many aspects of the body.
Yeah. And, a lot of people with ochratoxin have skin problems because of this whole, even not, the persister part of it. And because the kidneys are trying to grab as much of the bioflavonoids in your blood as it can so it doesn't take on too much damage. And the skin takes a hit. So if you can support these bioflavonoids, I have people who chronic psoriasis, age spots, these kinds of things, acne rosacea. When we get the bioflavonoids going, we get the ochratoxin out of their body, then the skin says, thank you. I needed that. I needed those bioflavonoids. But of course, the body in its wisdom, if it's being poisoned, it's going to prioritize getting rid of the poison over having beautiful looking skin.
Well, and I think a lot of times it's engaging the skin to try to help with whatever little detox that that the skin can provide too.
Right.
So when I see that, every time with psoriasis, and so I'm glad you brought that up, because it is an autoimmune. So the immune system's gotten confused and attacking the skin. But I think it's partly because the skin has really been trying to be that fourth or fifth pathway to get rid of the toxins.
Absolutely. Yeah. Yes.
Yeah,
I love it.
So you want to know
my gliotoxin tips? Should we go?
Yes, let's do gliotoxin.
I'm just love to I want this to be so actionable and helpful for people, that they can take this and run with it.
Well, and I really love how you're, pulling the science and then have an action plan. So that's great.
Yeah. Thank you. Yeah. I mean, that's the best we can do. And with functional medicine and naturopathic medicine, we know these tools already. So when I see zeaxanthin, I'm like, oh, I know how to use that. I know the dose. I know, so I know the safe area, I'll use up to 24 milligrams of that. No problem. because I already have a friendship with these things. So it's just very
Comfortable.
easy.
They're tools in your toolbox that you use for other things already.
Yeah, right. Yeah. So
There's great
gliotoxin,
data behind astaxanthin, like great data.
great data.
It's one of those supplements that if you're gonna like do a top 10 or top 15, like what do I want to prioritize putting in my body? It's a really great thing to be prioritizing for prevention and anti-aging and all those things anyway.
Yeah. Yeah. And then you think, well, how is it really helping with anti-aging? It's probably detoxifying
Yes.
helping you just get rid of all of the load. Yeah. So amazing.
Great connection. Good job.
That's good. I should get that on my, it's a good point. Even if I don't have ochratoxin, it'd probably be good to put in my rotation.
Yes, for
Yeah.
sure. Prevention.
Yeah. Thanks, Doc.
Well, I'm having so much fun with this because I'm like getting takeaways from every
Good.
one of these sessions. So this is great. Thank you.
Yeah. Yeah. That is the fun thing, isn't it? I love to watch the summits too. And I love to, attend medical conferences, obviously, but with summits, just the contemporaneous chatty, so much comes out. There are so many pearls where it's just like, oh my gosh. First of all, never would have thought to ask that question. And then second, like I didn't know that about this or that. So yeah, thank you for doing these.
Putting the puzzle pieces together. It's so fun. And
Mhm.
yeah, it just makes us all better.
Right. There's so much to know. There's so much to learn.
No, I could just nerd out every day. But the practical part and seeing patients get better is even the most fun. So
Great. I know. There's no problem getting out of bed in the morning,
yeah.
It's like, I love what I do. Yeah.
Yay. All right. So gliotoxin.
Gliotoxin lays the red carpet for fungus, particularly aspergillus, which is the one that can become pathogenic and infective in our lungs. They're seeing it in sinuses. Dr. Dennis in Atlanta, he's seeing aspergillus fungal balls making mycotoxins in the sinuses, and I am sure it's also colonizing the gut. I mean,
Absolutely.
or even infecting the gut, because we're able to see, when people pass a biofilm, I want to get a fungus test of these things. I haven't done that yet, but it's just like a whole load just takes off of their body.
So I'll tell you, just LabCorp has been a great way. They do a 4-week stool culture. A lot of times I can pick up the gut aspergillus with that, and it's usually covered by insurance.
Oh, fantastic.
Mhm.
Thank you.
Yeah.
That's a great tip. Yeah.
So
Perfect.
easy
So
for
I hope
patients. They don't
everyone's
have to deal with test kits or anything. So,
Yeah.
and they're not perfect, but a lot of times if it's there, they will pick it up.
They'll get it. Okay. So thank you for confirming that, because I'm like, I know it's in the gut. I know
Oh,
if
for
it's
sure.
here every time you swallow, if it's in your
Yeah,
sinuses, it's in your gut.
of
This makes
course.
sense. Yeah.
Especially if you
So
think about how mold
gliotoxin,
grows, it's
right.
like contiguous, taking over.
Right. Yeah. And if it's neurotoxic and immunotoxic, if it's in your sinuses and able to make mycotoxins as well, and even if you're breathing mycotoxins, we know it's affecting your gut wall. So of course it's going to be easier for it to set up shop.
Mhm.
So the gliotoxin is a virulence factor, which in normal person language, that means it's assisting the aspergillus in being more infective and able to infect. So it can take it from a spore to an active, where it's invading from just a surface level. It can take it to an invasion. That's where we get infection rather than colonization. And gliotoxin is really tricky because it creates, if you have a high gliotoxin, it creates sort of a Goldilocks situation with sulfur. And what I'm saying, it's sort of this middle window. If you don't have enough sulfur, you can't kill the aspergillus. If you have too much sulfur and not like a high amount of sulfur, so if you have that middle where the Goldilocks liked it, that can actually be helping the aspergillus make more gliotoxin. So gliotoxin or sulfur fuels aspergillus's ability to make more gliotoxin. It's a highly unique mycotoxin because it has disulfide bonds, which is similar to our IgG3, So if you have patients that have a low subclass IgG3, that's a gliotoxin problem. You don't even have to test it. We know it. I know it from my practice. I'm like, oh my gosh, all these kids with hypogammaglobulinemia. I'm like, I need to see your subclasses. If I see that IgG3 low, I'm like, you're in mold. We got to get you out of mold. So this disulfide bond, when you take just enough sulfur to help the aspergillus, but not you, and just enough to not overwhelm the aspergillus and help your immune system kill it, because too much sulfur is toxic to aspergillus. It's like it gives it way too much of its favorite food. So there's this weird little thing that you have to do with gliotoxin. If I see gliotoxin on any kind of mycotoxin testing, it gets my attention first, because we can be unfortunately making the gliotoxin situation, or the ability to make gliotoxin situation, worse if we try to address some of the other mycotoxins. So if we're going right into glutathione, alpha lipoic acid, these are all thiol-based molecules that contain sulfur. We see a lot of patients with high gliotoxin not tolerate sulfur. And typically also then what you see is they don't tolerate oxalate foods, salicylate foods. This is the sulfur component or connection. So if I see high gliotoxin, I take my patients off sulfur foods. I take them off sulfur supplements as much as possible, get the bioflavonoids on board, and get the antifungals going as quickly as possible in any way that we can get it. It's nystatin in the nose, if it's, anything. Because if we can get that aspergillus load down, then we can come in with the sulfur containing thiols, and they feel better. They can tolerate the foods. They can eat garlic again. They can eat onions again. And the reason they couldn't is because the gliotoxin was, or the sulfur was helping the aspergillus out before. So their body was saying, don't do this. I don't like it. Our bodies are so wise. And then when we get the antifungals on board, all of a sudden you can eat these foods again.
So what are your favorite antifungals? You mentioned a nystatin nasal spray. What else do you see as helpful?
It's all over the board. It depends if they handle plants. I'd love to have plants as the foundation, and because they have the wisdom, they have the, they know the kind of the instruction booklet, and then that drug can come in with a single action, and you've got now a wide and a high activity. So I love to start with thyme. Thymus vulgaris. It's like a garden weed for a lot of people. And it is amazing because it has this property where it actually stops the mycotoxin production of the molds. So what mold will do if you start to add antifungals, we see that if you give amphotericin B to aspergillus, it will increase its production of gliotoxin to defend itself.
It's getting attacked, yeah.
Of course it would, right? So that's its bioweapon. Stop doing that to me. I'm going to poison you. What thyme does is it comes in and it shuts down that mechanism. So if you preload with thyme, sometimes people just need the thyme. Typically I use thyme and then, for a couple of weeks, and then add in some other plants like oregano or neem or pau d'arco. It kind of depends on what they have going on. Pau d'arco is great for deeply embedded mucus. So if it's somebody whose sinuses are like this, they're talking to you, I'm like, you need pau d'arco.
I love that. I actually got to taste some pau d'arco when I was in the rainforest years ago.
Where did you go in the rainforest?
It was way, way deep into the Amazon in Peru.
Oh, me too.
It was an overnight boat trip on a rickety boat with about 16 people. I can't believe looking back, I did that now, but it was so amazing to be with the Shipibo people and have them show us some of the different plants. But I was, it's the medicine they use, right?
For so many things. Yeah, not just the fungus. Oh my gosh, we have so much to talk about. I did a botany study in the Peruvian Amazon. So when you meet these plants, I'm just chilling. I have chills.
Me too.
Oh my gosh. They're just so benevolent and they're so present. They speak to you. They are there and so I love to pick the plant, kind of the person. A lot of times I'll just kind of go to my medicinary shelves and be like, okay, who wants to play?
Well, and for those of you listening, this is how pharmaceuticals were evolved. And even, back to some of these mold toxins, that's where penicillin comes from. And it's
Right.
where, mycophenolic acid is being used to do immunosuppression for transplant patients. So the whole pharmaceutical industry is based on these, the mechanisms of plants. But when we use them in the whole plant, a lot of times they're much more in alignment with the body than just taking that high dose one mechanism. There are lots of mechanisms in the plant. So I just wanted to clarify that in case we sounded a little out there.
Yeah, so well put. And yeah, I can definitely sound very out there because
No, but I love that because I think I do the same thing where I really, when I'm making these choices, even, whether it's a medication or whether it's from our antifungal
Mhm.
nutrition status, like I, I don't do the same thing for every person. I just kind of tune in and see what I think is going to be the most gentle but effective.
Yeah, right. And then they all have their different mechanisms, and those mechanisms are pretty well studied now, which is nice. You can kind of get the idea that a clove is more resinous. It's going to act like a podarco. It's going to act on that really mucousy, thick, phlegmy. And there's a whole lot of research that on the alkaloids and on the components of the plant that the pharmaceutical companies said, oh, here's the active component that's antifungal. We'll make a drug out of that. But like you said, it was so well put, when you have all of it, then the body knows what to do with the debris and the detritus from the dying it off and the antioxidant and the anti-inflammatory part. And, it's more than just that one action that we need to do the cleanup crew. So the plants have all that stuff in it. Yeah.
And it sounds like you have a really similar approach too. Like with the pharmaceutical approach, it's just like one mechanism, but especially with these, I'll just call them fungal infections or fungal overgrowth. I find
Hmm.
that I have to hit multiple pathways to really get
Yeah.
the infections down.
Yeah, definitely. So I'd like to, that's, my kind of secret is with gliotoxin, start with thyme because we know that the gliotoxin is probably being made in-house, not just in your house, but then the aspergillus gets into your sinuses, into your gut, and it's going to start making it in-house. And so we can take the time and say, we're going to shut down the mechanism for you to be able to make more gliotoxin so we don't have to burden the body. That gives us a window to start some of the other ones. So quite commonly, like a really sick patient, I'm using IV nystatin or intranasal nystatin, itraconazole with then a blend of plants to kind of hold the space. If there's my favorite plant to use for that is garlic because it's safely used with every single antifungal pharmaceutical. There have been great studies on that. So, I use a lot of tinctures so I can kind of just mix and match what I want, which is really, I feel very
That's
lucky.
great. Is that how you do the time too? Is it
Yeah.
in a tincture or what is in
Tincture, capsule. Tincture I find works better because I think that the capsule doesn't open up early enough in the
Mhm.
gut process to catch where the first seeding of the aspergillus ended up in the small bowel. So I love to use the tinctures or glycerates for kids. And then just, say, here's your 2 weeks of just time. Now here's your bottle for the next, period of time, which is usually, it's fungus can take a while. They're very tenacious. Might take 3 more months. So here's your next bottle with time plus, and then we'll add whatever we need. If it's going to be like for women, it tends to be more things like sage, rosemary. For kids, more of the resins like the cloves. And again, just whatever their symptoms are. If there's SIBO, I throw oregano in there. If there's, pau d'arco, if there's asthma or deeply embedded mucus. And so it's just really, mixing and matching with the patient. Not everybody likes to take the tincture, so there's some blends that I like.
Yeah,
Makes it a
they're
lot easier.
a little strong.
They are. Yeah.
But
Yeah.
if you can tolerate them and just like have the conversation in your head, this is really helping to get my microbiome back
Hmm.
and
Yeah.
think positive rather than, oh my God, this is so strong or tastes so bad.
Yeah, right. I know that some kids from my practice, when I run into them as, young adults, they're like, "Oh yeah, we remember when we had to take those tinctures," like you become part of like the mythology or the stories of that family because they're like, "Oh yeah, our parents used to have to pay us to take it." Like, well, whatever. You're
Whatever
looking
it takes
good
to get you better.
now. Right.
That's awesome.
Yeah, it's kind of
The
fun.
This is so good because I think this is such an important piece of understanding the impacts of mycotoxins. So for those of you listening, like, just if you were wondering at all, like, is this real? To be able to delve into this level of detail and science and making the connections is like, it just, all doubts should be removed. What's happening though is because this is such an evolving understanding in science, you get brilliant people like Dr. Crista putting really important puzzle pieces together that help us all.
Yeah. Yeah. Oh gosh. Thank you.
Yeah.
So we talk about zearalenone.
Yes, that's such
Okay.
an important one too.
Yeah. So I'll just recap on gliotoxin. Short-term, no sulfur diet, getting on the antifungals as soon as possible, and then moving into high sulfur to try to compete out that. Basically, it makes the aspergillus spore blow up, swell and blow. So that would be the high sulfur things are thiols is the category, alpha lipoic acid, N-acetylcysteine, glutathione, and those would be the things that can help with healing to get all that gliotoxin out and the aspergillus presence. Yeah.
Beautiful.
Yeah. And then when you're
I
on
think this
glutathione,
is
then
so much
that
more
takes care of so
common.
many more mycotoxins.
Yeah,
Yeah.
beautiful.
I'm sorry I cut you off.
Oh, I was saying, I think this is so much more common than we think because it is a little challenging to test for. You know, you don't always get the easiest way to test to find the colonization.
Right. Right. Yeah, there's definitely some limitations on the testing.
Mhm.
Strengths
Yeah,
and weaknesses with every lab, so we just
absolutely.
mhm, yeah.
Yeah.
So zearalenone is an endocrine disruptor, but it's so much more than that. It's also toxic to the heart muscle. And that's what a lot of people are missing. And they're like, focusing on the estrogen part, which is really great. I love that people are paying attention to the fact that, oh, this mycotoxin is a little different than these other things that we've been talking about called mycotoxins. So helping the estrogen piece through I3C, and that's indo-3-carbinol, think of what that was. And so I don't even know what DIM stands for. I couldn't even
It's a
say it.
long word.
Di-indo-methyl, blah, 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 blah. Yeah.
Yeah.
They're like very similar molecules, a few molecules apart from each other, and using both assists because some people can't move the pathway, and so they need help on both sides of that metabolic pathway to get the estrogen detoxified. There aren't great studies on calcium D-glucarate. I went and I dug and I dug and I dug and I couldn't find anything more recent than like 1993 or 95. So I know that some people are using it and are seeing the level go down, but I don't know if it's as efficient as I3C and DIM. Those are what I
Yeah,
need.
I usually use a combination.
Mm-hmm.
Sometimes I'll
Yeah.
just start with the dim, but then I just find people get where they need to go quicker if I do the combination and
Yeah.
then follow the labs.
Yep.
I love it that you did the literature search. Thank you.
That's what I do. Yeah. I just get on these like on a scent, where I'm just like, I want to really know. Because I was seeing in practice that it wasn't coming down as quickly. And I was thinking, oh, it's estrogenic. I'll use calcium D-glucarate. Like, things aren't moving. What if I did it like my estrogen dominant patients where I use DIM and I3C and things are moving faster? So then I went out to the research just to see, is there validity to that? First I practiced on my patients and then did the literature dive later to understand. And I don't know what that is. I'm sure people who really understand that metabolism, estrogen metabolism, people who specialize in women's health, I'm sure they could just right now tell me exactly what that is, but that's what I'm
Yeah,
seeing in my practice.
from what I see, I just think that the recirculation of the estrogen, the reabsorption is diminished with the CDG. Mhm.
Reabsorption. That makes sense then.
Yeah,
Because if
but
the
more like a
zearalenone, it's
binding.
already in the system. It also binds to albumin with high affinity, not as strong as ochratoxin, but it's a binder as well to the albumin. And so using the things that I was saying, the astaxanthin, zeaxanthin with zearalenone, because you want to try and bump that off. But there's a little bit of a hack there, which is because zearalenone is also toxic to the heart muscle, we can use hawthorn, which contains a lot of those bioflavonoids and nourishes the heart muscle. And what I love about hawthorn is it helps the heart feed itself first, because the heart doesn't do that. it feeds itself second. Isn't that sad? Feed our hearts first.
Well, I
So
think a lot, especially, as parents, we often are like, it's kind of how we do things where we're in that giving mode more than the receiving mode. So I can
right,
see how that would be just what the heart does.
right. That's what the heart does. And
So how
so
does it help? I don't
physically,
know about hawthorn. So how does it
oh,
help
I
with the
love hawthorn. Hawthorn, I like to use it in a solid extract, ideally. I find that it's more effective that way than in a capsule. But, if someone's like, oh, I can't do the taste, to me, it just tastes like you're eating jam. So I have a
oh,
lot of patients who are just like, oh, yeah, I'm picking my hawthorn, I'm just licking it off the spoon. But for kids, some kids are like, I don't know if I want to do that. Then I can use rose hips solid extract or rose hip syrup. And what that's doing is that's giving the lycopene, which we know has its own mycotoxin protectant, but it is also full and rich in those bioflavonoids that can help the denaturing. So you can kind of take, it's that multiple mechanisms of action, multiple modes of benefit with reducing the total pill count and, how many things someone has to take. So I will combine that combined I3C and DIM with some hawthorn solid extract or rose hips if it's a kid who's like, I think it's really yummy, but I'm a weird herbalist. So, there have been some kids that don't like the hawthorn, but hawthorn specifically has that heart feeding mechanism where it's, and I always get it wrong if it's inotropic and chronotropic and what it's doing, but it's helping the heart muscle have a more complete contraction and then expansion to feed itself first.
beautiful.
So if I have a kid who doesn't like the hawthorn, I have the parents try to mix it in with the rose hips so that we're at least getting some hawthorn so we can prevent the myocarditis.
Do you have a
Because
brand that you like for those?
Hmm?
Oh, sorry. Finish up and then I'll ask you.
No, as you know, in the last few years, there's something circulating that's pretty hard on the heart.
Extremely.
Yeah. So I've been just plowing through hawthorn. Yeah.
Okay. Do you have
Yeah.
a brand that you like? Because that's a new one for me.
The Herbalist and Alchemist is one, and then Wise Woman has, I think they still have it. I'm just looking on my shelf real quick. My Wise Woman one is still in stock, but those were two that I use. I think I'm right now, or because I'm doing mostly telemed, then people can get Herbalist and Alchemist.
And it doesn't matter if you're male or female for that one. Like if you have
No,
exposure, the
it's
same
really
protocol.
bad on men because not only is it estrogenic, it is toxic to the Sertoli cells in the testes. So you get actual destruction of the testes. So when in families, a kind of a classic picture is mom and kids are sick, dad is not, dad's a little irritated. Yes. Is this really mold? And I say, let's test your testosterone. And if there's zearalenone in the house, the testosterone is low, below 300 easily.
Mm-hmm.
Yeah. And so when they say it's not affecting me, I'm like, yeah, it is actually. And it's going to show up in loss of muscle mass, insomnia, irritability, libido issues, hair loss. That's not what any guy wants. So it's affecting them, but not in a way of like an allergy. And that's the thing we have to get people over, is that we hear about mold allergy, but it's so much more than that. And if, we've just talked all this time about these mycotoxins, that's not an allergy thing. That's a toxin. Yeah.
Yeah. Which I think, or I think most people understand about lead now.
Mm-hmm.
So yeah, it's just as toxic or more than lead or cyanide or
asbestos. Yeah.
asbestos, the common things that you hear about wanting to avoid. And to me, these are even more toxic than those things.
Because they're genetically toxic. So it can be a heritable trait, basically, to be immune deficient.
Yeah.
And it just sets kids up for autoimmunity. I mean, there's my second book is on PANDAS and PANS, because mold is so often that core exposure is so often a contributing factor to developing PANDAS and PANS, because mycotoxins, because they're fat soluble, they like to go to the fattier tissues, and one of those is our brain, bone marrow, gut, yeah. So these kids, then they're totally treatable. You know, once it becomes autoimmune, then we're dealing with a little bit different situation. But, you know, kids can be treated for mold. I mean, I have a whole course called Mold in Kids, because not everything that we would do for an adult that we do for kids. You know, there are certain things we want to make sure we're not detoxing them too hard. We don't bind them too aggressively because we could cause nutritional deficiencies. So there are certain things that we need to modify when we're working with kids, but it's completely treatable once you've been exposed. I mean, you're living proof of that, you and your family.
Yeah, I think that's really what's inspired me to, you know, be able to hold space for people. Is you can recover and be even better than you were before you got sick.
Yeah. So do you hear this from families? I hear families say, now that we're past it and we're looking back, this is probably the best thing that could have happened to us, because we decluttered our life, we simplified, and we became so health conscious that, you know, it probably is setting us up for not having the diabetes and the hypertension and all those things later. Yeah.
I totally feel that that's the case when we implement what we've learned and stick with it. You know, the lifestyle changes and the most important supplements, and really learning better how our detox pathways work.
Yeah.
Yeah.
Right.
Are there any other mycotoxins that you find particularly important or interesting? Any of the trichothecene family, any of the ketoglobosin? Is there anything else you want to add on any of the other toxins?
Yeah. Oh my gosh, those get scary. So I was
Okay.
Yeah, but the chetoglobacin it's from chetomium, which is a water loving mold. So if you have chetomium in your environment, you have a water problem. And it doesn't mean flood. That means a consistent slow drip somewhere. That can also be in your refrigerator filter. I tested a bunch of refrigerator filters and I found chetomium in them. Took them
No
out.
way.
Yep.
That's a good tip.
It's like, so I have a little video on my website. I do these short little video blogs, like a minute or less. I try to keep them, you know, because mold brain is a real thing. It's a very real thing.
It's a very real thing.
Yeah. So I was just curious. And so I tested refrigerator filter, because I was in the mode of, you know, let's test everything so I can learn.
Where'd you send
And
it?
I work with my inspector. So I just said, I want to test this. Send me some stuff. What do I need? And she said, I'll send you some swabs and some containers and whatever. So I started testing galore on that. And so I found chetoglobacin and chetomium in the filter. And then actually I found chetomium, not chetoglobacin, on that first one. So I'm like, called my parents, how long have you been using your filter? And they were like, 2 or 3 weeks. I'm like, can I test it? I'll buy you a new one. So I tested theirs, chetomium. I tested a friend's, chetomium. I keep testing.
Oh my gosh. So do you think it's coming in the water, or do you think it's already present in the filter? Where's it coming from?
I have no idea, but there's no standardization on any of those refrigerator filters, first of all. And so I think because it's stagnant, chetomium loves stagnant water. So it's not going to be one from a flood and then it's dried up. It's from a drip, you know, slow drip trapped water, which is the situation for a lot of our families, because they didn't know it was a problem. You know, like the refrigerator line in the back of the fridge can just have this slow drip leak.
Yeah, that happened to my parents.
Oh my God.
Not enough that you could actually see it behind the wall or under the floor or anything, but it was creating a pretty massive mold problem. So that's why I try not to even connect the water filter.
I recommend that people don't, because you're going to run it through a filter that has chetomium, which has a mycotoxin called chetoglobacin, which can cross the blood-brain barrier. It's one of the few. Eniatin is a trichothecene, can do it too. A lot of them can ride our olfactory bulb back up to our head, but chetoglobacin can cross the blood-brain barrier.
That's the one that made me so sick, and it was in my air conditioning system. And I think just being in Texas, it's like we just get condensation in our AC systems. You know, they running through the attic, even if they're insulated, they just condense. So
yeah. And so if you're not managing that, that's the thing, is like maintenance is the key. Running dehumidifiers,
and having the right size air conditioning system, and so that it actually dehumidifies.
Mm-hmm. Yep. There's so much science to it that we know, that I don't know. HVAC, I think, is a very important specialty to have right, and hiring the right people.
So I had somebody have a huge aspergillus problem in their coffee maker. They had like one of those really fancy $3,000 coffee
Yes.
makers, and it was full of aspergillus.
Keurigs, anything that has sitting water. So that's why I tell people, don't even hook up the line to your fridge. Just go old school ice trays, because anything that has sitting water, we have a problem. CPAP machines. I had a patient with dementia, completely cured by making sure she cleaned her CPAP machine. We got her a new one after it was tested with chitomium and aspergillus and high endotoxin, very high endotoxin, because she's like, that's bacteria probably, from herself that was able to kind of set up in her CPAP. So I like the system. It's called So Clean. It's an ozone cleaning system for CPAPs.
That's a really good tip.
It's so great. It's a closed system, so you don't get ozone out into the atmosphere because that's toxic to lungs. So it closes it in, and it runs it even through the fan and the air handler part of it, because that's where a lot of the mold is on the little fan. And it will degrade valves and things like that. So you need to know there's a risk factor that it's going to age your CPAP machine a little faster, but you're not going to get dementia, so.
Well, that's not a bad idea to replace that something regularly anyway.
Agreed.
Might need to be an annual purchase.
Yeah, agreed. How with the So Clean though, it's testing really nice and clean even years later. Yeah.
Great.
I know. Just simple, and it's such an easy system. You take it off, you plunk it in, close, you don't even think about it. So it's awesome.
So what other places do you look for mold when it's not obvious?
Whoa, baby bath toys. If they have a little hole for, the aeration, that's a place for mold. And then baby's taking a bath in mold and mycotoxins, and goes right through the skin. These mycotoxins can go right through the skin very easily. So checking baby bath toys, making sure you don't have anything that has that little air hole in it, if it's a plastic, it's just hole. And I've had parents, cut them open and then send me pictures. I was like, yep, there we go. There it is. And then
really great detective work. That's
I'm obsessed. I think it's probably a problem.
No, because it really is, sometimes it's challenging to find the sources.
Yeah, I know. And they can be so weird. And now a baby bath toy is a big deal because it's a little person with a big, bath water, and our skin is so efficient at taking in mycotoxins. But some of the other ones, like the Michael Rubino he has a great Instagram at the Michael Rubino. He has all these little things where they found mold, like at the bottom of if you have toothbrushes, if you have a toothbrush holder, like that should make sure that's drying out. That should have air in it, not a holder with a contained airspace, because that's wet every day.
And I just had one with my toilet bowl cleaner.
Oh yeah.
Yeah.
Mm-hmm.
Because it had
So
a
everything
lid
needs
over the
to,
top of it. And it, like I bought a nice one. I just wanted it to look nice. So it was totally sealed.
yeah. And then there you go. It'll grow. And a little tip too is people say, oh, doesn't every toilet tank end up moldy? And I can say in my experience so far, if your toilet tank grows mold, you have mold in your house somewhere. It's not natural for that to grow mold. In most situations, there may be a situation where you haven't used that toilet for months, and maybe that makes sense. But no, if you've got it growing with, the frequency of flushes that happen in most family homes, there's mold in the environment, and there are a lot of spores available to that. Yeah. So just little things like that. And then trichothecenes, their main thing that they do is protein synthesis inhibition. So I like to use any kind of amino acids that we can get into their body, like the essentials, either a branched chain amino acid or a mixed aminos, because all the systems in our body, our enzymes and everything, run off protein, run off amino acids. And if the trichothecenes are sitting there saying, no, you can't make that protein, that's going to slow healing, especially the gut wall. Yeah.
Yeah, that's a great tip.
Great.
You're just such an amazing source of information.
Thank you.
I feel like I could just talk to you all day.
I think we could talk, and then we can talk about Peruvian Amazon. That's going to be fun.
Yeah. Yes, definitely. So I know you are just on such a mission to get information out to the public, but then also to healthcare providers. So for anybody listening in either of those categories, how do they find you?
Yeah, they find me at drkrista.com. That's drcrista.com. And I have courses for public and information for the public. I have fact sheets on mycotoxins. And then I have a doctor training course. They can become mold literate. You get CME for it and everything.
Amazing.
And then,
congratulations on that. I did not know
thank
that.
you.
That's a big
Yes,
deal.
that is a big
Continuing medical
deal.
education has to be approved by, the more allopathic model. So the excellent job.
Yes, thank you. And then I have a short course coming up called Updates in Mold Related Illness, which is going to be a few months yet. And then I have a training course on PANDAS and PANS for practitioners as well, because that's my other passion project as a mama of kids with PANS from our mold.
Oh, I did not know that kills.
Been there, done that.
Makes you really learn it to the deepest level.
Yeah, you got it.
Mm-hmm. Well, thank you so much for your wisdom, your huge heart, your brilliance. And I know this interview is going to help a lot of people to better understand what's going on with them and how to help.
Great. Thank you so much for the invitation.
Thank you.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks, real talks from real doctors on the issues that matter to you most.